Talking about STIs with your partner isn't the most comfortable conversation to have, but it is an absolutely important one to have if you're planning on having sex. And there are some very important do's and don'ts when it comes to talking about it to your partner. First off, don't start the conversation with your partner over text. It's a serious, sensitive, and very personal topic, and if you're willing to be sexually active with a partner, there's no reason you shouldn't be able to talk to them face to face. Talking about exes isn't always the most comfortable topic, and neither is talking about STIs, but an important conversation to have, both to know you and your partner's risk of having an STI and any past experiences they may have had.
So, have you slept around? I mean, how many people have you hooked up with before me?
So, have you been with anyone before me, and have you done anything with anyone that could be at risk for an STI?
I have had some relationships before, and I have had sex. I haven't been tested, but I don't think I have an STD.
Yes, it is true that the more sexual partners you have, the higher chance you have of contracting an STI. But that does not mean that you should be shamed for your sexual history, or for having an STI, especially from your partner, someone you're supposed to trust. You can even get an STI from having sex with one person.
I understand and thank you for telling me, but I think for our own benefit, we should both probably get tested for STIs.
I can live with that.
So you've been sexually active and something seems off with your fun parts. Don't self-diagnose. It's difficult to tell yourself that you have an STI. You may be in denial when you are at serious health risk. Most men who have contracted an STI show symptoms, but only 20% of women show symptoms and would receive a positive reading for an STI test. So even if you're sexually active but you don't think you have an STI, it's better to use protection and get tested, because you may be endangering your partner. When left untreated, some STIs like chlamydia, gonorrhea, and types of HPV can cause infertility or even cancer. However, people can often assume the worst when something is going on in their body.
Give it to me straight. Gonna fall off.
No, it's just genital warts.
People often confuse canker sores with cold sores, or rashes and cysts with fever blisters. When worried about a potential STI, the best thing you can do for yourself is go to a doctor and get tested. An STI test isn't a comfortable thing. STIs can be tested for in various ways, such as blood tests or genital swabs.
Of course, if you're sexually active and worried about contracting an STI or having an unwanted pregnancy, which you should be, your best friends are contraceptives. Surprisingly, reports from the Center for Disease Control has found that from 2006 to 2010, 78% of teenage girls and 85% of teenage boys reported that they used contraception the first time they had sex. The same study had shown that 16% of teen males used a condom in combination with a female partner's hormonal method, and the number of teens wearing condoms is growing. Though most teens are being smart about reaching for protection when they're about to get physical, putting on a condom isn't as straightforward as you may think.
Healthy relationship where you trust and respect someone and become intimate, the best way to respect your partner and yourself is to practice safe sex.